Good afternoon, ladies and gentlemen. Welcome to this new segment of your destination for the latest medical trends by hosting the medical professionals Medcast. Kidney stones is a very common health issue that can cause discomforts in many patients nowadays. Thus, knowing the causes of the kidney stones can play a crucial role in treating the kidney stones and also preventing the formation of the kidney stones. That's why we are honored today to have Dr. Abdurrahman Ali Al-Kindri, who is a senior specialist in urology and genitourinary surgery. Welcome, Dr. Abdurrahman.
Thank you so much for the interview, for you and for the team, and I hope it will be easygoing and informative interview.
I hope so,
Thank you.
actually. So, Dr. Al-Haman, there is a very common question regarding your job, which is the urology. And many people ask themselves, what is the difference, firstly, between the urologist and the nephrologist?
Okay, first of all, basically it's depend on so both of us treating the kidneys,
Yeah.
and the kidney has multiple problems, including the medical field and the surgical field. So the urologist concentrate more on the surgical field.
Hmm.
One of the problem that we use to treat is the kidney stones, which
Hmm.
is super common,
Yeah.
as you said before. So this is the main difference.
Okay. So, based on our introduction we had before, which is the brief we had about the kidney stones, can you tell us more about the kidney stones and how they are formed inside the body?
Okay, kidney stones, as you know, very common,
Hmm.
and most of us has one of his family, friends, relatives,
Or even sometimes himself.
himself maybe.
Yeah.
Yeah, correct. So why it's common? Because we have multiple factors lead to make it common. How
Hmm.
common it is in Kuwait? We have multiple studies around the world and in Kuwait as well, assessing the incidence of the kidney stones. So,
Hmm.
for example, in Kuwait, a study performed here showing that from 100,000 patients admitted to the hospital, to the emergency department in the hospitals in Kuwait, 43% of them, they are complaining of renal colic, which has happened secondary to the kidney stones or urethral stone.
Hmm.
So it's 40% of the admission to the hospitals complaining of the kidney stone. So it's like huge common. From the whole population, we have 10% from the whole population has any episodes or history of kidney stones. Why it's from secondary to what you eat.
Hmm.
So we eat a lot of salts. We have a high risk of forming stone secondary to the dehydration that we have because we are in the hot area,
Yeah.
definitely. So in the 40s, more common than other age. This is the peak age, 40s, and in the male as well. Why? We don't know. Maybe secondary to the job that we are doing. I'm not pretty sure. Maybe we are exposed more to dehydration.
Probably
But
they are unlucky enough to have the kidney stones more than
maybe,
females.
maybe,
Yeah.
maybe. So this is the main factor. So we don't have a cause, but we have a factors: dehydration, eating, age, and gender.
Regarding treating the kidney stones, some people might give an advice for their friends to use some sorts of drinks, as you have heard before, probably a lot. And I think it's some kind of rumors that the medical professionals get used to hear every time from time to time. Now, some people might advise their friends to have parsley drinks or some non-alcoholic beverage so it can help melting down the kidney stones. Is that the only way of treating it? Or as a medical professional, do you have another way to prevent or to treat the kidney stones?
So number one is this stuff
Hmm.
are really benefit? Is the patient get any benefit to take this stuff? The answer is most likely no.
Hmm.
So the parsley is super common. Most of our people, most of our patient keep asking about this.
Yes.
Is it preventable? It's not. And in the other way, it may cause more stones.
Hmm.
Why? Because the parsley is very rich with oxalate.
Hmm.
And most of the stones that we develop over all the world is calcium oxalate. This
Hmm.
is 80% of the types of a stone.
Hmm.
So parsley has high oxalate. The oxalate will combine with the calcium and it will form a stone. So in
Yeah.
the long term, it's not good at all. In the short term, it has effect to be a diuretic. So it may increase the volume of the urine.
Hmm.
Does it play a role in helping to passing the stone? We don't have any evidence showing that. But the evidence that we have is the high fluid intake. Definitely, it will help to prevent stones formation.
Regardless of the type. So it's not about like
Correct.
having a parsley drink or the non-alcoholic beverage.
Correct.
You
100%.
always recommend having a high fluid intake.
100%
Yeah.
correct. About the non-alcoholic beer, yes, we do have some evidence, although it's a weak evidence. but it showed that it decreased the calcium oxalate stone because it has some effect of citrate. So the citrate, which is very good, and I recommend most of my patients to have a citrate, especially the patient who has history of kidney stones. It's very effective, and it is available in the lemon juice and in the orange juice. Basically, the citrate will work very easy. It will stop the combination of the calcium and
Calcium with the
oxalate,
oxalate, yeah.
and it will take the calcium out easy with the stool, and just make the oxalate free, and it will come out easy without forming a stone from the urine. So citrate is very important. Other stuff that we recommend the patient to have to avoid kidney stones, as I said before, fluid intake,
Yeah.
and the amount is 2 to 3 liters according to the guideline and the recommendation per day.
Okay, let's make that more clear.
Sure.
Is it only fluid intake, or you are emphasizing for the patients to have water more than any other things?
Fluid intake, actually.
In general.
In general,
So because
fluid.
some people might think that having like juices or cold beverage is a part of the fluid intake you would consider.
Yeah, I'm talking about the fluid intake is 2 to 3 liters, but some fluids are not good for forming stones, especially coffee, because the coffee has high oxalate. But in general, the recommendation to have a fluid intake to 2 to 3 liters per day. Water is the best. Water is the best, and it does not matter that what type of water you take. Is it salted water? Is it filtered
Yeah,
water?
they say that we have the high sodium or the low sodium ones with a pH and the
Studies
different ones.
performed assessing which is the best water to avoid kidney stones, and it showed that there is no difference
Yeah.
between the high salt water and the filtered water. So take a good amount of fluid is the key, not only the type. This is number one. So fluid, as I said before, citrate is very good to protect forming calcium stones. Like decrease the amount of salts.
As much as possible.
Try to avoid it
Yeah.
if you can. I'm talking about the sodium chloride, so the sodium chloride salt. Decrease the amount of protein in the animals, especially in the animals protein. Talking about like fish stuff, even the
Meat,
fish,
chicken, yeah.
even the fish. Yeah, it has very high volume of the oxalate. Decrease the oxalate food like nuts, like tea, coffee, dark chocolate. All of it has a high volume of oxalate.
Okay, now regarding the formation of the kidney stones, can we say that the stones are only formed inside the kidneys, or they can be moving to another parts of the urine system?
That's a very good question. So we have multiple theories how is the stone formed. The most common theory was what we call the supersaturation. So that's depend on your fluid intake. That will decrease the saturation definitely because
Yeah.
you are filling your collecting system with water. So dehydration and high salt intake. So this is like equation. When you have a high salt intake, I'm talking about the eat, and you have dehydration, you will increase the chance. So this is the theory number one. Theory number two is Arundel plague. Arundel plague is he's a person, he's a French guy who discovered that there is an area in the kidneys when it is damaged, it gets like an anchoring to form stones. So any salt will dissolve in the urine, it will attach to the Arundel plague, and then it will form a stone. And it's like a disease. So the patient who has a Arundel plague, he will have a recurrent stone. And looking to our population, we are noticing that any patient forming a stone, he will form another one. And this is proved by studies. 50% of a patient who has a stone or who develops stone in his life, he will have another stone 50% compared to the non-stone former
Which is a very
before.
big chance.
Very big
Yeah.
chance in 5 years. So Randall plague theory is strong as well.
So it can be formed, as you said, with that theories you have mentioned, and also can be formed anywhere in the urine system. It doesn't have to be only inside the kidneys, and can be moved out to the urethra or to the ureter.
So it's always in the kidney.
Always in the kidney.
But in special cases, the patient may develop a bladder stone. And the bladder stone usually happened due to stasis of the urine due to secondary obstruction, either like infravesical obstruction. Patient cannot pee for any reason, like benign prostatic hyperplasia or urethral stricture or neurogenic deficit that cannot help him to pass the urine and empty his bladder. He will have a stasis of the urine in the bladder. Stasis of the urine will accumulate the salts and then stone will happen. So we have kidney and bladder stone. We don't have a urethral stone. Most of the
Okay.
urethral stone will drop from the kidney.
Okay, that's great. Now, just to have a quick introduction for the next segment, does every stone formation would need a surgery to be removed?
Definitely no. Most of the stones will pass easy with the urine, either with medication or without. If we have a patient coming to us with renal colic, and just talk about the renal colic, it's, as you know, maybe because you are in the medical field, and for the audience, renal colic is a severe one.
Yeah.
Renal colic is a bad one. Renal colic classified as the number one most severe pain in the all pains in the world. So renal colic is bad. When we have a patient with renal colic, we are doing CT scan. That's the most accurate stuff that we can use to diagnose.
And then we later on would decide the
Decide
treatment
either for
plan.
medication, conservative management,
Or then
or
we will decide for surgery.
surgical management.
And we will keep the treatment plan for the next episode. For now, we are so pleased to have you in this episode. Hopefully, we can see you again in our program. Thank you for having us, and thank you for visiting us.
Thank you so much.
Thank you so much. Our dear viewers, we have reached to the end of our segment with Dr. Abdulrahman الكندري. Hopefully, we can meet you again with another healthcare specialist in the next episodes. Until that time, goodbye.